The importance of adverse event reviews.
The adverse events in New Zealand highlight that there are issues around either, making a diagnosis too early, or making it the wrong diagnosis or diagnosing too late. So I think taking that time to really understand what these set of facts in front of us could be and not explain it away too early with something that's convenient. And I think in that scenario, the care that will be given to patients will significantly improve.
Matthew saw a range of health professionals before he was admitted to hospital. He believes had they had access to all of his health records, he may have been diagnosed earlier.
I saw a GP, then a hospital, then an after-hours doctor, then another GP, then a hospital. So for me, the continuity of care wasn't necessarily there, and access to history is critically important. Now, I think it's very important that the patient, as I did, gives the history, but I think it's also helpful if the system actually supports the right type of decision making. So to have all of those records available to people, I've seen pretty much everybody except maybe a obstetrician and gynecologist. I think I've seen pretty much everyone else. My records are everywhere, the specialists, and trying to bring all those together, my scans and my blood results, and I think trying to manage those records is quite difficult, and then it's very difficult to then make decisions. I think you also end up with duplication of testing, and the quality of care would be improved by being able to connect all those things together more effectively somehow.
Matthew's a very capable person, so he can explain his history, but not everybody is in that position. And when you have to go through your history, you're reliving it to a degree. So it would be better if there were systems there that
to help.
Yes, so you didn't have to explain every single time.
Every time I go to hospital, I sit out filling out those admission forms, asking the same 26 million questions that I've been asked the last 15 times I've been to hospital. And there's more chance of error because I'm getting complacent. And so I think, how do we actually help patients do that kind of stuff as well?
Matthew talks about the importance of adverse event reviews and the work being done by Te Tahu Hauora Health Quality and Safety Commission to improve them.
It does remind me a lot of the things that I've seen over my career. I worked for 20 years in the oil and gas energy industry, where unfortunately things have gone wrong on many occasions. One of the things that I do see is that there is a conglomeration of what is happening. So what are the actual things that are happening? And that's always the first step, which I think is fantastic. I think the challenge is simply going to that why. Why are there problems with diagnoses, and also continuing to ask why. So I have no idea the answers to those questions, but why may they be misdiagnoses as well? We didn't have enough information. Were you given enough training to ask the right information? And then if you have enough training, do you then have enough resources? Is there enough equipment there, or are there enough people there? And then you say, well, if there aren't enough people there, why? Well, our budget constraint is there. So, well, why is the budget constraint there? So, well, somebody very much removed has set that, probably not understanding the implications. What I've experienced historically is the deeper you go in those why questions, the more impact an action coming out of that investigation will have on more people. The difficulty is there's always multiple things that are happening. It's never, in my experience, ever been one. So how do you get a consistent view? There might be, the top three, look for themes. Are we resource constrained? Do we have an issue around training or competency? Those kinds of system-wide changes, I think is the real challenge to find. And I don't underestimate the difficulty of doing that. But I think it really starts at the top, where people who are hearing the information must not accept simple answers to the investigations. They're always complex things. There's never a simple answer, and it's not about finding blame. It's not about finding who did this wrong. It's actually about preventing things in the future, and to do that, you've really got to find those deep root causes, which is the needle in the haystack, and that's hard, but it's very much worthwhile doing.
Thank you to Matthew and Diane for sharing their story. Find out more about sepsis on the Te Tahu Hauora Health Quality and Safety Commission website, hqsc.govt.nz.